There. Feel it?
Mm-hmm.
Typically, this is one point of 2 or 3 that I would use to help relieve pain. Depending on where along the back it is, I would use points either on the hand or the back of the knee or sometimes in the back itself. What I would tell the patient is you might feel your back kind of opening up or relaxing. That's not uncommon. I'll leave the needles in for 20 minutes. After 10 minutes, I come in and tweak them. And then following that, I typically do tween ah. And usually that's when we get the best results. There is another form of treatment called Moxibustion. Moxibustion involves burning moxa, or the herb mugwort, over a given acupuncture point for the effect of strengthening or tonifying that point. This is a stick of moxa. Moxa comes in several forms, and this is one of the most common forms, one of the easiest to use. I'm going to light this, much like one would light a stick of incense. And what I would do is hold it over a given point and tell the patient, once you start feeling it get warm, let me know.
Okay.
Now, I can do this either with or without a needle in place. For the sake of this demonstration, we'll do it without a needle. So just rest your hand and then tell me when you feel it get warm.
I can feel it.
Okay.
I can feel it.
And we would repeat this about 5, 6, 7 times on any given point. And that's Moxibustion. Now, the more modern way of doing Moxibustion involves using a heat lamp and a spray form of moxa. And the reason for that is the stick has a very pronounced odor to it. So the other way with the spray, the heat lamp avoids that odor and you achieve the same results. Okay, there's sometimes when I would want to perform moxa with a needle in place. So I'm going to use this point, the 4th point on the large intestine channel, Li4, or Hegu as it's called in Chinese. Okay. Now, once I have the needle in place, I will take some moxa spray, spray it. This is a far infrared heat lamp. Okay. The light from this is invisible, but you can feel the heat. So I would take it and place it over the point like such and leave it there for 20 minutes. A third form of moxa is a cone that we can place. It has a little bit of a sticky bottom, and we can place it on a given point, and we light it with a stick of incense. There you go. Now, you tell me when you start to feel it get warm. Just put it in the holder. Yeah.
Okay, I can feel it.
Okay. At that point, we remove it and put a fresh one on. And that's still another form of Moxibustion. Tell me if that's too hot.
I'm good.
One of the oldest forms of treatment is something called cupping. Cupping involves taking a cup, and there are two ways of doing it. The classical method called fire cupping, which I employ, and then there's a modern method using suction cupping where they attach a gun and suck out the suction. Personally, I think that technique has very little merit. It does achieve the suction, but you lose quite a bit of the potential of cupping by doing it. So what I'm going to do is take a piece of paper, light it on fire, place it into the cup, and then place the cup on her back. What will happen is the fire will go out, she will not get burned, but it will cause a suction, pulling out toxins and such from the body. If you watch the paper when this is removed, you can see the amount of air coming in. Now I'm going to do the same technique by using a needle under the cup. Right, so I'm going to put a needle in. And then place the cup over the needle. The reason I do this is because that makes the effect of both the needle and the cupping synergistic and much more profound. Okay. Let's see the difference. Cool, huh? The paper that I use, I found the best paper to doing cupping is table paper. The paper that you go to the doctor's office and it's on the table. That's all that this is. It just happens to burn very nicely. So a third form of cupping is called sliding cupping. What I'm going to do is take some massage cream, place it on her back to give myself a medium to put the cups on. So the cup is on her back. Now I can move the cup slide the cup along her back. Okay. If her back was bare, I could move all the way up the length of her back without losing suction. That's sliding cupping. When I perform cupping on a patient, it's important to tell them that they will have a black and blue mark. It won't be painful, but it will last several days. Typically, I tell patients that they look like they've been attacked by an octopus. Okay. Gua Sha is a scraping therapy. It's again a very old treatment. Some call it a folk treatment. It is a wonderful treatment for fevers. It's also a great treatment for certain muscle aches and musculoskeletal conditions. Basically what I'm going to do is rub some, this is Dragon Balm, very similar to Tiger Balm. It's a liniment that you place on the body. Then I'm going to use the lid to scrape and raise what we call Sha. Sha is kind of like toxins under the skin. What you'll feel is it gets warm at first and then it cools off. And it looks almost like it should be very painful. It looks like road rash, but it truly isn't. It does feel good. How are you doing?
Okay.
That's a nice amount of Sha there. Now, there are certain aspects of this medicine where you have to take off your Western clinical hat and put on your Chinese out-of-the-box hat. What I'm about to do is one of those. It is called Qigong. Qigong itself refers to the cultivation or the strengthening of one's qi, internal energy. But you can also use that, you can transmit it to other patients for a healing effect. So it is essentially Chinese energy work. It is the precursor to Reiki or therapeutic healing or healing touch, any of those hands-off energy works. This is the original. So what you'll see and what the patient feels are two different things. What you'll see is just me holding my hands over her body. What she feels is something different. I'll be the first to admit that Qigong is a little bit bizarre. It's a lot outside the realm of Western thought. It can't be quantified. But just because I can't prove that it doesn't exist doesn't mean it doesn't exist. I can't prove that your mind exists either. But I'm sure you have one. So what I'm going to do is allow my qi to circulate and to essentially expand out through my palms and transmit it to her body to effect a healing response. Typically what patients feel is a sensation of warmth. So here we go. I typically place one hand on the patient's skin somewhere, in this case her arm. Often it's a forehead. Although it's not necessary, you can do it hands off completely. But most of the work is coming through this hand for this particular technique. So this is it. Typically, patients go into a pretty deep state of relaxation. How do you feel? What did you experience?
Just warmth and relaxation.
That's Qigong. When we talk about the flow of qi through the body, there are several points that are pretty heavy energy centers. We call them the dantian. Now, the primary dantian, the most common one, is right below the belly button here. There's also one in the middle of the chest here, and there's one at the forehead, where I put the needle originally. So by kind of getting all three of those to open up and to harmonize and to communicate, you can effect an incredible cycle, a wonderful flow of qi.